Hi, everyone. Thank you so much for joining today's webinar. We'll be discussing the Emergency Solutions Grant Program and the recent provisions in the CARES Act and how some of these resources are being embedded into short and long-term housing and homelessness prevention efforts. As we all know, the COVID-19 pandemic is threatening both the economic and housing stability of millions of Americans. So we're very excited to be able to have this important conversation exploring some of the tools and resources that are available to help community development practitioners mitigate the impact on housing security and stability locally. We did want to mention that, sorry, I'm just going to go to the next slide. We did want to mention that while we know we're discussing ESG primarily today, it is one piece of a larger picture. So while we will discuss recent policy provisions, we're also going to hear a little bit about how some of this funding can be used in tandem with other federal resources to allow for more holistic relief effort and some longer-term housing strategies as well. I'm very pleased today to be joined by three excellent panelists. We have Richard Cho from the Connecticut Coalition to End Homelessness, Marlisa Grogan from HUD's Office of Special Needs Assistance Programs, and Callahan Seltzer from the LISC housing team. And before I hand things over to Marlisa to get us started, I did just want to run through a couple of housekeeping items. The webinar will be recorded, so the recording along with the deck will be shared with everybody that registered for today's webinar. Everyone is going to be muted throughout the presentation, but if you have any questions, feel free to share them at any point via the Q&A or chat function. And it seems like we probably have too many people to open it up for discussion, so we'll keep everyone muted. But if you'd like to be unmuted at any point, please feel free to raise your hand and I'll unmute you. With that, I'll hand things over. I'll hand things over to Marlisa to get us started on the policy update. We can't hear you at the moment. Not sure if you're muted. Marlisa? Uh-oh. That's odd. We may need to have you dial back in. We're not hearing your audio right now. So we may just have to move on and come back to that. Yeah, Richard, if it's okay, we'll just move on to your part and we'll come back to the policy update afterwards.
Okay, no problem. Can you hear me okay?
Yep, we can hear you.
Sounds great. Well, thank you for having me. I hope Marlisa can provide some of the federal context on what's allowable. What I wanted to do is share a little bit about the context within our particular state in Connecticut on how we're responding to the COVID-19's impact on our homeless population, as well as around broader housing issues, and talk a little bit about how ESG is being used, as Sarah mentioned, in addition to some of the other federal funding streams that are available. So on the next slide, just wanted to provide a little bit of background on our organization. We were founded in 1982, so we've been around almost 30 years. And we started as a coalition of mostly emergency shelter providers and transitional housing providers. Today, we represent over 100 organizations and people who include business leaders, government agencies, other statewide organizations who all share the collective goal of ending and preventing homelessness in our state. We have a common goal of making homelessness rare, brief, and non-recurring. We play a number of different roles, including providing training and technical assistance. We help advise on policy directions. We have helped to design our statewide coordinated access network system for homelessness. We also administer homelessness management information systems. And then we also directly administer some of the flexible funding that is being used alongside other housing programs and interventions to assist people experiencing homelessness to connect to stable housing. On the next slide. So we started seeing in our state COVID spread in our state beginning March 7th, actually was the first known case of COVID in our state. And since then, Connecticut has been alongside New York City and other Northeast states, one of the kind of hotspots and epicenters of the COVID pandemic. And, it's had significant impacts over the last 3 months or so. Our focus and the focus of many of homeless service providers and housing providers in our state have almost entirely really shifted towards the COVID response, and we've been working closely with our state government and their state emergency management system to respond to homeless shelters, including authorizing what I think is one of the most proactive examples of COVID prevention within the homeless system in the country, where we've moved roughly 50% of our state's homeless population into hotels. So on the next slide, actually, I'll skip over this to provide a little bit of context on how the homeless system works in Connecticut. Years ago, if you were experiencing homelessness in the state of Connecticut, like in many communities today, you have to basically navigate an array of different housing and homeless assistance programs. You would call or show up at the door of a shelter, and if they didn't have any beds available, you'd walk across town to the other shelters. And then once you were in a homeless shelter or experiencing homelessness, you might apply for 10, 15, 20 different housing programs and be on 10, 20, 30 different waiting lists to try to get access to housing. And if you had been assisted with connecting to stable permanent housing through one of those programs, the other programs might not even know that you were no longer need to be on that wait list. And so we realized having that kind of a decentralized, uncoordinated system wasn't any way to organize homeless services. So with the guidance that we've received from HUD and from other national organizations, Connecticut created a coordinated entry system, and we not only created community-based coordinated entry systems, but we did it on a statewide basis. So in our state currently, if you're experiencing homelessness, you call our state's 211 info line. 211 conducts a high-level kind of triage to understand what are your overall housing needs, or if you're in urgent need of homeless assistance or currently experiencing homelessness. And if 211 cannot resolve it through other services referrals, they'll connect you to one of our 7 coordinated access networks, which are essentially regional homeless services networks, who will conduct what used to be an in-person assessment and then determine if you could either needed shelter as well as placement onto a housing waiting list, or if you could actually be diverted from homelessness. And then once if you could not be diverted and you were experiencing homelessness, they would put you on an active, what we call a by name list, where they would connect you to a variety of different types of housing interventions, everything ranging from rapid exit or rapid rehousing, which are either one-time or short-term rental assistance, to vouchers or affordable housing units or permanent supportive housing. And we've used this system to achieve really steady declines in homelessness over the last several years. We've achieved a 32% decline in homelessness since 2007. And of course, the COVID pandemic has really, in many ways, both disrupted as well as in other ways kind of enhanced and accelerated some of the efforts that we've been making to try to end homelessness. The next slide just shows how the homeless regions work. We have 7 separate regions, which are called Coordinated Access Networks, or CANs. Again, they receive referrals from 211. And then what the CANs do is try to divert households from shelter, where they manage access to shelter. They also coordinate homeless outreach, and then they also match homeless households to various housing programs. And the fact that we have a statewide homeless management information system that's also connected to our statewide 211 system enables us to really look at the overall picture of what homelessness and housing needs look like in our state. And I'll come back to some of that in a minute. But I want to talk a little bit about our COVID-related response. So on the next slide. So we've had, since the first case of COVID arrived in our state, a somewhat evolving response. As I was mentioning, we had been making major pushes to end homelessness with a particular focus on families and youth in our state prior to March. But kind of overnight, our whole focus really shifted towards really responding to the COVID pandemic. In the early days after March 1st, we really focused mostly on how to help prevent COVID outbreaks within our homeless shelters through a combination of cleaning, social distancing, and we also began to move some of the higher risk folks based on age and other underlying conditions out of congregate shelters into hotels. We realized in mid-March that most shelters would not be able to comply with the CDC's recommended guidance for congregate settings and homeless shelters in terms of how to keep beds spaced apart, as well as to socially distance people enough to prevent outbreaks. So we convinced our state to help us to move as many people out of congregate shelters as possible, so we could actually space beds apart as well as space people apart in hotels. And so on March 10th, our state issued an executive order and received subsequently FEMA approval to help us move what is about 50 to 60% of our homeless congregate shelter residents into state contracted hotels. And so we've been doing that for the last couple of months now. I'll talk a little bit more about that in a second. And now we're sort of moving into a new phase where with our shelter decompression in hotels ending July 2nd, we're now shifting towards a new strategy where we're doing a combination of systematic testing of COVID as well as rapid isolation of COVID positive persons, along with trying to keep our shelter census low by really scaling up the effort to house as many people as possible, as well as divert more people who are newly falling into homelessness. So I'll go into some of this in a little bit more depth in the next slide. So as I mentioned, on March 10th, our governor issued Executive Order 7P, which authorized the decompression of congregate shelters by moving shelter residents as well as staff into hotels. We received FEMA approval for reimbursement. We've now gotten that FEMA approval for the reimbursement of non-congregate sheltering approved for 2 extensions. So currently July 2nd is the end date. The state may seek additional extensions if needed. And the state agencies actually directly negotiated and contracted directly with those hotels. The shelter providers across our state coordinated on helping to relocate 50% of our shelter residents into hotels. You may ask, how do we decide who to do that? Mostly it was based on particular shelter sites that were not able to spread people apart. So it really was driven really more by the physical configuration and the density of shelters as opposed to other considerations. They also moved staff and operations to those hotels that provided case management to shelter residents who are currently in hotels and providing 3 meals a day. The hotels also really rapidly, we partnered up homeless services providers with community health centers as well as behavioral health agencies to provide more wraparound care. And so for the most part, we've been operating with a shelter system that is split between some of the existing 60 or so shelters that had operated and also 15 different hotels in our state. On the next slide. Realizing that hoteling was only a temporary strategy and knowing that at some point we had to return back people back to shelters, we also knew that putting people into congregate shelters at this time with COVID, it's nowhere near ended, and we're also talking, hearing about another wave of the pandemic, thinking about how do we have some more medium-term changes to our shelter system. So with the goal of trying to maintain our homeless shelter census as low, our partners across our state have set an ambitious goal of housing about 1,000 people in the next 120 days. So on March 1st, when we, March 7th, when we started seeing COVID come to our state, we had about 2,009 people across 63 different shelters in our state. Currently, about half of them are in hotels. Our thought is if we can actually move about 1,000 people out of homelessness into hotels while diverting more people that newly fall into homelessness, we can try to maintain a shelter census that was roughly half of what it was prior to the COVID pandemic emergency. So one of the things we're doing is making every available resource be utilized to assist with this rehousing effort. The state had, even prior to the COVID pandemic, made about $900,000 in flexible financial assistance available that we're using to both provide security deposits, one-time or a couple of months of rental assistance, as well as other flexible uses to help divert people from shelters, as well as to do something we call rapid exit, which is providing that really flexible one-time or short-term rental assistance. In addition, our state received, between our state agency as well as some of the ESG communities, about $12 million in emergency solutions grants through the CARES Act, which our state is primarily using for rapid rehousing. So providing short-term rental assistance that typically ranges from anywhere from 4 months to 12 months, coupled with housing navigation and case management supports. In addition, our state is able to create an additional 300 units of permanent supportive housing through some of their state rental assistance program vouchers, as well as some new HUD mainstream vouchers that we've just recently were told that we've been awarded. We've been engaging landlords and realtors to help assist with identifying any additional vacancies. We also engage with the Rapid Results Institute to assist us with some process improvements to figure out what we can do, even as some regulations related to housing inspections and other things are being relaxed. How do we accelerate the effort and the processes to connect people to housing? And then last but not least, we're exploring how to use CDBG and other resources to assist with expanding shelter diversion as well as homelessness prevention. Next slide. I want to also just quickly mention that in addition to people who are currently in shelters or who are on the streets, we also knew that there are a lot of people who come out of incarceration and wind up homeless. Even prior to the pandemic, my organization had matched our data with our State Department of Corrections. We found that about 20% of our state's homeless population were people who had been released from prison or jail within the last 3 years. With shelters taking fewer new admissions during this pandemic, and most providers really reluctant to take any new admissions, anybody coming out of prisons who are, particularly those hitting their end of sentence, so our State Department of Correction could no longer keep them in prison. They were legally required to release them. And if they had no home destination, they would wind up on the streets. So think about people coming from a prison setting where COVID cases could be fairly high, and then being released to the streets where they'd be, out and about in the community, not to mention experiencing homelessness. So our state was able to actually come up with $180,000 in justice assistance grants funding, which is JAG money that most state criminal justice agencies administer to help work with us to stand up really quickly a reentry housing assistance program where we're providing a combination of flexible funding, in some cases to provide hotels, in other cases to provide short-term rental assistance, security deposits, help with moving costs, for others providing up to 4, 6 to 9 months of rental assistance. And so we were able to quickly put together a reentry housing program during the COVID pandemic emergency as well. On the next slide. So I want to talk a little about what we're seeing in terms of needs. And the reason why I brought up the reentry housing was, this is a time when we're seeing kind of a confluence of so many different housing needs. We're trying to move homeless people out of shelters. We're trying to deal with the fact that there's still people who are unsheltered and sleep outside. We know that hospitals and prisons and other institutions are struggling to try to move people out. And so we're struggling with how do we address the housing needs of that population. And meanwhile, as many of you know, many states have passed an eviction moratorium, and the federal government has also placed some reductions on evictions, but that's quickly coming to an end. And so people are worried about the flood and the wave of new evictions that are coming down the pipe. So think about how to balance all of those needs. I want to share a little bit of what we're seeing in Connecticut. One of the ways that we look at the degree to which people are experiencing housing needs in general in our state is by looking at our 211 data. And one of the things we track is how many people call 211 every month asking for some form of housing and homeless assistance, which, by the way, is the #1 reason why people call 211 in our state. Well, what we found actually is that comparing March and April of this year to March and April of last year, we're seeing roughly the same number of calls coming in for housing assistance. And so far, and again, our state's been under a partial moratorium of eviction, so we've not seen the flood yet of people who are facing new evictions or falling into housing crisis yet. And some of that I think might be because people are still collecting unemployment, people are not getting evictions or their filings are not being reviewed by courts. And so we've not yet seen that, but we're tracking this over time. We'll look at May's numbers now that the month of May is finished. We'll look at June and see whether or not we're starting to see an uptick in the number of people who are calling 211 saying, I'm about to face eviction or I'm facing housing loss. On the next slide, we also haven't seen that 211's rate of referring people to our coordinated access networks. In other words, those that 211 says, I think these folks are either homeless or on the verge of homelessness. That number also is relatively unchanged from March and April of this year compared with March and April of last year. But you'll note, typically on any given month, about 50% of the people referred by 211 to our homeless services network actually show up for those appointments. In the last month, because we've moved towards a telephonic system where you no longer have to have an in-person appointment, the homeless services networks, or CAMs, have been able to field a lot more. So we're now actually able to see about 60% of those appointments actually taking place as opposed to 50%. And that's a sort of unintended but good benefit of the way that we've shifted towards virtual assessments. Next slide. We've also seen that as shelters are scrambling to try to reduce new admissions, that shelter diversion, so instead of referring people just immediately to a shelter, but saying, hey, how can we help you resolve your housing needs, either help you keep your home, find a safe alternative, or potentially connect you to a new home through financial assistance as well as housing problem-solving counseling. That has actually really upticked in the last couple of months, where shelters and the coordinated access networks are diverting more households than ever out of shelter and out of homelessness. And then on the next slide. So as you can see, our hoteling effort has really reduced the number of people physically in shelters. So this is people who are physically in shelters by about 50%. That the biggest decrease is among single adults as well as seniors, which makes sense. So you can see 54% fewer single adults physically in shelter beds, 58% fewer seniors in shelters than prior to the pandemic. However, on the next slide, you'll see that the number of people enrolled in shelters as shelter clients, so whether, regardless of whether they're physically in a hotel or in a shelter, that has only decreased by about 15%. So unless we actually house as many people as possible who are shelter enrolled clients, we may be returning almost as many people back to shelters as were there prior to the COVID pandemic, and which is why our efforts to really rehouse people as much as possible, as well as to step up our shelter diversion, is really important. And so the next slide, I want to just summarize that we're really thinking about all the different ways that federal dollars can be used to help us to house as many people as possible, prevent new shelter admissions, assist with some of the housing needs of people who are being discharged from institutional settings, as well as to think about and plan for what may be a potential wave of evictions that may come about in the future. So here's a little bit how we're thinking about this. In our state, we've been able to get FEMA approval to reimburse 75% of the costs associated with non-congregate sheltering, which includes the costs of the hotels themselves, the cost of meals, as well as additional staffing that our providers are incurring. Second, our state was able to determine, I believe this is the case, that they can use the coronavirus relief funds out of the CARES Act to cover the portion of the non-congregate sheltering that FEMA does not reimburse. So that other 25%, the state can actually use their coronavirus relief fund portion of CARES Act to cover those costs. What that means is that we can actually really use the HUD-related money that comes out of the CARES Act, ESG and CDBG, to fund rental assistance. So our state's primarily using ESG to fund rapid rehousing rental assistance alongside staffing to provide housing navigation and case management. And our state's also looking at how to use our CDBG funds for shelter diversion, homelessness prevention, and potentially even eviction prevention down the road. In addition, HUD has also provided some other resources that weren't necessarily COVID-related, mainstream vouchers, as well as existing housing vouchers that turn over, and we're looking at ways to use all of those to increase permanent supportive housing availability for people who are currently homeless who need more support. And then finally, I wanted to point out that there's also something known as the Coronavirus Emergency Supplemental Funding that the Department of Justice and the Bureau of Justice Assistance administers, and they provide to state criminal justice agencies. And we're exploring how to use those funds that come from the Department of Justice actually to expand the reentry housing assistance program that we were able to put together through JAG funds for people who are reentering or diverted from prisons or jails. So that's just a little bit of a sense of where we are today in terms of how to think about all the different federal funding streams that are available to try to assist with the many, many housing needs that we're seeing. So with that, I'll turn this back to you, Sarah.
Thank you so much, Richard, for that great overview of how CCEH is effectively using the available federal resources to respond to both immediate housing needs as well as thinking about how to rehome people in the future and respond to and divert them from shelters down the road. I think Marlisa was able to rejoin, so just in the interest of time, oh, sorry, there's so many sirens. In the interest of time, I might pass things back to her to give the policy update, and then we can circle back to do some questions after that. So with that, Marlisa, I'll hand things over to you. Marlisa, you may be muted again. Let me know. I'm just going to give Marlisa a moment to try to log back in, but in the meantime, Richard, we actually have a question for you. Does Connecticut have a state agency that coordinates all of these funding strategies?
Sorry, yes, we have a couple of different state agencies that administer this. Our State Department of Housing, they act as a housing authority. They also are one of the ESG recipients for the statewide share. And then they also administer the community development block grants that are not administered by entitlement communities. And so they typically award the CDBG funds not administered by entitlement communities through an RFP to some of the what they call smaller cities. So they have a CDBG Small Cities program. And then we also work with the municipalities that administer their own ESG and CDBG dollars and have been trying to inform some of their efforts. And I think there's been, for the most part, a kind of common thinking across the state as well as those municipal agencies. And then we work with our Office of Policy Management, which is our state budget office, that ultimately makes a lot of the higher level decisions regarding how the state's using their coronavirus relief fund, as well as they are the state agency that administers the Department of Justice related CARES Act funds.
Thank you. Okay, it looks like, Marlisa, are you able to share audio?
Can you hear me?
Yep, we can hear you.
Oh, great. I'm so sorry for my technical problems.
No problem at all. I'm just going to go back a little bit. Okay, great.
Okay, it's great to be here with you all, and I really welcome the opportunity to brief you all on just an overview of our ESG CARES Act supplemental funding. So the CARES Act provided $4 billion in additional funds to the ESG program for activities specifically preventing, preparing for, and responding to coronavirus. So on April 3rd, we issued our initial allocation, which is one of two, to our ESG recipients, the same ESG recipients that received their 2020 allocation according to the 2020 formula that goes to states, territories, metropolitan cities, and urban counties. Our formula remains generally the same, but we do have some changes when it comes to eligible recipients among metropolitan cities and urban counties. We do have some recipients that drop in and out of eligibility depending on how the formula shakes out for a particular fiscal year. So we still have a second allocation, $2.96 billion, and that is going to be allocated via a new formula, which the Secretary is developing, and it will also take into account some needs, some data related to COVID conditions. We are working feverishly to get that second allocation out, and that should be distributed shortly. The CARES Act also gives HUD the ability to provide flexibility and for alternative requirements as well as waivers. And the idea is to make it easier for ESG recipients to use their ESG CV funds as well as their regular ESG allocation for coronavirus response. We've issued several memos already that provides recipients some flexibility in how they carry out their funds, such as a waiver of the fair market rent requirements so that recipients can just use rent reasonableness standards. We've given some flexibility when it comes to reevaluations for the homelessness prevention, homelessness prevention reevaluations, as well as monthly case management requirements. So we're trying to take into account the challenges when it comes to meeting with program participants virtually instead of in person, as well as just the high amount of stress and lack of capacity that recipients have, recipients and providers, when it comes to just the demands of coronavirus response in general. And in order to show their constituents how they're using funds, each recipient has to publish how it's going to use its ESG CV allocations. We've waived the public comment period and citizen participation requirements, but in lieu of those, recipients need to post their plans for ESG CV activities on their internet at their appropriate government website. Next slide, please. This slide outlines initial flexibilities that are provided in the CARES Act itself. ESG typically has a 100% matching requirement, and for ESG CV funds, there's no matching requirement. We've also waived the spending cap on emergency shelter and street outreach activities, which is typically limited to 60% of the fiscal year grant or the amount of funds that were allocated for homeless assistance activities under their 2010 grant. So that's 60%. Generally, 9 times out of 10, and they'll be their 60% of their fiscal year grant amount, and there's no cap for CV activities. And then we've increased the admin activity limit, expenditure limit, from 7.5% to 10%. And we've also increased the at-risk of homelessness income eligibility requirement up to 50% from 30% area median income. There's also flexibility provided when it comes to procurement standards. So the typical procurement standard or procurement requirements under Part 200 have been relaxed, and in general, whenever using ESG CV funds, recipients cannot require people experiencing homelessness to receive treatment or perform any other prerequisite activities as a condition for receiving assistance. As I had mentioned before, there's no citizen participation or consultation requirements. There's also no minimum period of use for temporary emergency shelters. I forgot the temporary there. So the typical minimum period of use requirements do still apply for emergency shelters in general, but there's a new category of eligible activity called temporary emergency shelters, such as sprung structures, or in general shelters that don't meet our habitability requirements and are intended for COVID response. And there's no minimum period of use requirement for those. And the CARES Act also extends YHDP, that's the Youth Homelessness Demonstration Program. It extends that 2018 obligation deadline to 2021. Next slide, please. So some of the key takeaways when it comes to ESG CV funding is that these funds are available to plan for intermediate housing needs when it comes to communities' COVID response, looking at the next 3 to 6 months. ESG provides short and medium-term rental assistance, and we can also provide rental assistance under rapid rehousing for those who are experiencing literal homelessness, as well as those who are at risk of homelessness. As you can tell from the number of waivers and alternate requirements, this program is intended to be flexible, and it's typically the first program looked to by continuums of care when assisting those who are at risk of experiencing homelessness, since the continuum of care program cannot provide homelessness prevention assistance unless they're a high-performing community. And ESG is also unique in its ability to provide assistance for emergency shelter. LISC signed a bill proposing $100 billion for ESG to support emergency rental assistance, and we're also advising, that's just for your information, and ESG recipients, we're encouraging them to immediately amend their most recently approved annual action plan. So that's really the fastest way to get access to funding. It is possible to include their ESG funding strategy in their current plan that they're developing, their 2020 plan, if it hasn't already been approved. But the quickest way to get that done and get to grant agreement is by amending their approved annual action plan. So that's information if there are any recipients in the audience. But as Richard pointed out, it's really important to think about how to use different funding streams together. And so, you know, think about CDBG, home dollars, and then other funding that's available within the community to prevent homelessness through rental assistance, new non-construction improvements to affordable housing, and FEMA dollars as well. Next slide, please. And so I just want to leave you with an overview. I've sort of touched upon this in the earlier slides, but here's just an outline of ESG eligible activities under the current program, recognizing that the CARES Act also provides the temporary emergency shelter activity. And then once the ESG CV notice is released, you should all stay tuned for that for any additional activities that we're able to provide through the flexibilities of the CARES Act. So stay tuned for that. But in general, we use ESG activities such as street outreach, engagement, providing essential services to those living in unsheltered situations, a variety of emergency shelter-related activities such as renovations, which includes rehab and conversion, shelter operations, providing essential services to those within emergency shelter, and then rapid rehousing, which includes short and medium-term rental assistance, housing, relocation, and stabilization services, and then the same type of activities under our homelessness prevention component, which is reserved for those who are at risk of homelessness or at imminent risk of homelessness. And with that, I believe I'm going to turn it back to you, Sarah.
Great, thank you so much for that overview, Marlisa. We do have a couple of questions, so if it's okay, I'll just pause for a moment to ask you about some of those. So given how our allocations are made, we did have a couple of questions regarding how this plays out in rural areas. So Bonnie Craigie wants to know, how do the needs for rural areas get met, or is it through the state allocations?
That's right. So if your community, if your jurisdiction does not receive funds directly, which is typical for more rural areas, the funding gets awarded directly to the state, and then the state in turn will either do an RFP or they will run their own formula and then allocate funds either to urban counties, metro cities. They can also award funds to our non-entitlement areas, which would be, you know, the smaller cities, counties, and then they also have the ability to award funds directly to nonprofits. So, so that's typically how it works. We've been providing guidance to, you know, to those local providers and rural areas to be in close contact with their states and make sure that your needs are really known, since it is the state's function to apply for FEMA funds, and it's also your key to getting into supply chains. So where supplies such as PPE, other equipment to make sure that facilities maintain their infection control standards as far as hygiene and sanitation goes. It's really important to be in touch with both local emergency management as well as, you know, just running up the chain through your state to be looped into that, into both the supply chains and access to CARES Act support.
Great, and you touched on this a bit, the next question already, just in noting that the awardees can be nonprofits, but we did also have a question, if there's anything else to expand on there, that if ESG grantees are states, counties, and territories, do nonprofits have to engage with those entities to access ESG and how can intermediaries work with state and regions in rural areas to help get these funds to actual homeless prevention and housing providers? Uh-oh, Marlisa, we may have lost you again. Oh, no. All right, we might need to just move on to Callie, and then we can circle back to Marlisa at the end for some additional questions. Marlisa, are you there? Okay, we'll move along, Callie, to your piece at the end, and then that's interesting. It seems like a lot of people are getting kicked off. So Callie, sorry about that, everyone. I have all the questions down, so we'll be sure to address them at the end of this. But we'll move along to Callie's presentation.
Thanks, Sarah. And this will be recorded, so if you guys are having an issue dialing in or a tech problem, which it sounds like a few people are right now, hopefully you can go back and reference. So I'm Callahan Seltzer. I'm the Director of Housing for LISC, and that is the national side of LISC. So we cover our field sites, 35 of them, and also our rural network. And I today just wanted to talk to you guys briefly about how we are thinking about ESG across this network and sort of the longer term impact of COVID and how we start to stack resources and think strategically about relief and recovery. You can do the next slide. So I'll just briefly, I don't think any of this will probably surprise anyone at this point, but as housers or people that touch affordable housing, we know that this was already a crisis before COVID-19. And that the roadmap out of this crisis is a bit unclear. It's a patchwork city by city, state by state in terms of when eviction moratoria will expire, what resources will be there to protect people at the from the federal government, HEROES Act being out there but not yet real and funded, and also the state and local resources. So I think it's just maybe universal statement at this point, but there's a lot of communities that we serve, particularly communities of color, disproportionately affected by this. And that means rent burden, housing unstable, at risk of homelessness or in and out of homelessness, shelter cycle. And then also stacking that with the industries that have shed the most jobs in recent weeks. Something like 45% of renters, or maybe more actually, this data is a few weeks old at this point, in the 30% AMI category across the country actually work in those industries that have shed jobs. And if you think that COVID-19 is like a 3-month issue, then that's one way to look at this. If you think that we need longer term solutions and longer term at the property level and housing stability level, then I think that we're trying to push people in that direction. But yes, in short, it is exacerbating those existing inequities and supply problems in our housing system. We can move to the next slide. Again, I think this is probably what you guys are all seeing in your communities, but tenants losing income, can't pay rent, and this waterfall effect of owners or landlords not being able to necessarily pay their lender or their mortgage, taxes that would go to the city going unpaid, services that would be provided to residents, also no money to pay for those. For our affordable housing partners, the on-property costs are pretty unbelievable just in terms of how PPE has been paid for in the past couple of months. And I think going forward, this is not a expense that's just going to go away. We're going to need to continue to provide safe, healthy housing, and the cost of that every month will either accrue or be paid for in some new creative way. And hopefully that includes a large infusion of government support. All right, we can go to the next slide. So we're thinking about the housing components of COVID-19 across kind of 3 time horizons, that immediate, which has been February, March, April, May, all the way to where we are now, that response period. and then that intermediate, the recovery phase, you know, and hopefully some of the housing efforts will maybe be on a clearer path. And certainly the short-term policy decisions that are made in the next couple of months will affect how deeply impacted our communities are around housing. So whether it be evictions or mortgage foreclosures or just housing instability, and frankly the psychological burden of worrying about whether or not you can continue to be housed next month is very, very real in the places where we work. And then that longer term, the regenerative or the fuller recovery. And I think we're trying to encourage our partners and to think with us about how do we get somewhere better than where we were before this, you know, the pre-crisis already being a compounding housing crisis. How do we actually protect and expand community-based ownership, create more equitable housing systems long-term, and more production. There's a lot of challenges I think we'll be facing on the new production or that housing pipeline, if you will, of hard units. And those are challenges that each of you will see differently in your sites, but very real because soft subsidy resources in cities and municipalities have so much pressure right now to, to plug funding gaps, to solve for the immediate rental assistance needs so that people aren't on the street. And it's really hard right now to figure out how to keep powder dry, essentially for that longer term housing recovery and regeneration. Okay, next slide. So 3 types of solutions that we think we need now, and this is just our framework, and we're very open to other thoughts. So please, chime in. But we need solutions that do provide that immediate housing stability, which I think Richard and Marlisa both talked about. As the ESG being a really strong option for that. We also need solutions that support the continued solvency and operation of the overall affordable housing ecosystem. And so that's helping groups with, capital that they need to stabilize properties, to stabilize affordable housing landlords and owners, and also preserve properties and put them on a trajectory toward longer-term affordability. And then the third solution bucket being, how do we scale up affordable housing production to, what's already a worsening crisis? And how do we get new options for rapid rehousing? How do we surge resources for community health workers onto properties so that they can do the kind of testing and on-site work with residents that we know we need going forward? So this is the 3 timescales and kind of the 3 types of solutions that we're talking about. And I'll get in the next slide a little more into what we think that looks like. So just to marry that frame of thinking, how do we keep powder dry? So that we can address some of these issues and not just keep playing what I would call a pickup game. It's probably a bad sports metaphor, but it's really hard to think long term about how you build your squad or how you, have a strategy for housing when we're always just trying to kind of pick up the pieces here and there. And unfortunately, that is, that is the reality right now for so many of you. But I think that if you look at these federal resources over kind of over a continuum of from the left to the right here, I've got sort of resources that can be used for the immediate rental assistance needs, immediate on the ground right now needs, all the way to that longer term, keeping some powder dry so we can get some more units. We can actually be additive out of all of this. We can get use dollars that are most flexible to produce new housing or new forms of rental assistance. So this chart intends to just kind of lay out, what can you use these dollars for? So ESG here at the top, CDBG, home, and also the Coronavirus Relief Fund. I've left many, many others off, and we can do an expanded chart if that's of interest, especially for the DOJ funds that Richard mentioned. But thinking about how do we move not just from the rental assistance, but toward those longer term production strategies and which dollars get us there. And so use the dollars that are most flexible to fit your strategy. But that's really about building up from the question of what's happening in my neighborhood, what are the strategies that fit that? And then what are the resources and how do I stack them? That's a very different kind of approach than a pickup game of just like throw money at this, switch the bucket, throw money at that. And I know that that's so hard for all of us to do right now because we are having to respond to such immediate needs on the ground. But we're trying to work with our partners to think about that longer term, like building your squad, like stacking your resources to actually fit the needs happening in the neighborhood, and being very data driven about that. We know we have some of the tools. We need to be able to tell a really nuanced story about what's happening locally. And the truth of this, the truth of this crisis right now is that, you know, the whether the courts are open in your city matters. You know, that actually does have to get tied into your overall housing strategy. The courts, meaning, you know, eviction courts and whether they're going to be able to evict people going forward, you know, whether people have some kind of solution for a mortgage that's in forbearance, you know, whether there's forgiveness. All of these things really do get tied up in the fate of people's housing. So I wish it was a simpler way to look at it, but we're hoping that we can drive people to thinking about that longer term, 10-month to 1 year to 2 year regenerative effort, you know, building back better than we were. And we can move to the next slide. So that's all just to say, thinking really carefully right now and strategically about what resources to put where and also when. Saving some of those more flexible resources that can be used for acquisition or new construction, like home dollars, one of the only resources that can be used for new construction, right? So when your developers or your housing partners 6 months from now have a housing gap to fill for a new construction project, if there's no home money left in the coffers, that project might not happen. So I think it's important to think across, you know, like what's the pipeline of projects that are coming our way and how do we kind of convert some of these temporary relief efforts into that longer term picture. And I'm actually going to stop talking because I feel like we've covered the big picture here and we want to make sure we have plenty of time for more questions and specifics for Richard and Marlisa, and I see some stuff coming through in the chat. So get in the weeds about the policy pieces and keeping the bigger picture in mind, hopefully. So thank you.
Thanks so much, Callie, for that great overview. And we do have a couple of comments before we move to questions that from Logan Harris, an expanded chart would be really helpful. So if there's if that's in the works, then we can also circulate that when we share some follow-up when we share the recording and deck for the webinar. And we also had a comment that the CLT model is definitely scalable with the proper financial support, long-term affordable, attainable, and sustainable housing that will support neighborhood stabilization and generational wealth building through home ownership. So support for that.
Yeah, no, I couldn't agree more. CLT, community land trust model, you know, to the extent that you can use dollars now to acquire properties that might be, frankly, facing some kind of, on the commercial side of all this, like we all think about housing so frequently, but don't forget the other side of real estate right now, which is a severe fallout in commercial real estate. And that might present an opportunity, you know, to bring those assets into a community land trust, especially if you already have one established. You know, work with your city to get assets under community control and then, you know, reposition them in the coming years. I think that's absolutely the right vehicle. And I think that, I hope that we come out of this crisis with more community ownership, not less. And that's part of the preservation effort I was mentioning earlier, CLT being a very obvious vehicle for that. And then look at, you know, how do you stack the right money to actually purchase or acquire parcels or, you know, shopping mall pieces that could be, you know, converted into affordable housing, you know, in the parking lot. Just like understanding very locally what's happening with commercial real estate and potential dispositions.
Okay, very much agree, and thank you, Kelly. So we do have several questions, and Marlisa's doing an excellent job answering some of those in the chat. I'll quickly run through and just let everyone know that we'll also circulate these with that share out that we send after the webinar, so people have the links and everything. But one question, are the memos on ESG CD available for the general public to review? And Marlisa said yes. The waiver memos are available on the HUD Exchange and shared a link, so we'll circulate that. Another question, is there a per family maximum benefit, and there are limits per household to ESG rental system and housing, rental assistance, and housing stability case management. In general, there's a 24-month maximum. Another question, whether, a couple of questions actually about mortgage assistance. So would housing stabilization include mortgage relief for COVID-impacted homeowners be included under CARES Act funding? And can ESG be used to pay mortgages to prevent at-risk homeowners from becoming homeless? Marlisa confirmed that mortgage relief is not an eligible activity within ESG or ESG funding, unfortunately. And one other question, will any home funding be made available through the CARES Act in response to Marlisa says supplemental CARES Act funding has not been allocated for home programs? Marlisa, I'm not sure if you're able to share your audio now. I also see a question about the presentation, so we will be making the recording and the deck available just as a reminder. Marlisa, I'll quickly see if you're able to share audio before I move on to additional questions. Otherwise, I might.
Can you hear me?
Yep, we can hear you.
Oh, great.
Thanks. Apologies for all the technical difficulties. Thanks for your patience. We have a couple of other questions that have just come in. One question from Pam Presner. Does rental assistance through ESGCD, is it only for those who will become homeless within 14 days?
No. So under the homelessness prevention component for ESG, you can provide rental assistance to anyone who meets the
Oh no. Sorry, everyone. I apologize again for all of the technical difficulties. Marlisa has agreed that we can send these questions around to her, and she'll respond in writing, and we'll circulate those along with all of the materials that we'll be sharing. Richard, I did want to ask before we log off, for a lot of these programs, hopefully your audio is still working. If it is, for a lot of these programs that required amended plans, I wonder if you could speak just really briefly about how Connecticut went about that process and how they ensured that the community and some of the people that are closest to the needs were able to weigh in on that process as they thought about allocation.
Yeah, I mean, I think most of the agencies and municipalities that administer these funds have pursued their proposed plan changes, opened up for public comment. They've had to do virtual platforms. I can't say that we've gotten it perfect in our state with having a process that feels like it's been open to communities. This is coming at a time when the needs are great, the need to listen to communities and people that experience communities of color is more important than ever, and yet we're struggling with the fact that we have to do everything virtually as well. And I think it's just an ongoing challenge that we're having. But the agencies have done the right thing. I've been reached out to by a number of municipalities asking for background and support, and I think people are making efforts to try to engage the public for commentary and input as much as possible. But again, I think there's challenges, and I think we're facing something else that needs to be addressed, which is the digital divide, and the fact that a lot of the communities that we need to be speaking to are the very communities that don't have access to the kind of technology or have limited access to technology and bandwidth that enables them to really participate in what are now virtual public comment processes.
Absolutely. Thank you so much. So we are at time, but just wanted to say thank you again to all of our presenters and remind everybody that we'll make all these materials available. Anybody's questions that we weren't able to address during this hour, we will circulate written responses to. So thanks again, everyone, so much for joining, and thank you to all of our presenters. That was an excellent webinar. I really enjoyed hearing from all of you. So with that, everybody enjoy the rest of your afternoon and stay well. Thank you.